Root canals are among of the most fearsome dental procedures that a lot of people prefer to avoid due to fear of discomfort and pain associated to these procedures. Understanding the process of root canals, as well as what it can take, will assist in alleviating some of the worries and anxieties that accompany this routine dental procedure. What is a root canal procedure? Root canal procedures are the name given to a dental procedure carried out to fix the tooth with untreated or injured pulp. This is the tissue in the tooth, which is home to blood vessels, nerves, as well as connective tissue. When the pulp gets damaged or infected, the damage can result in severe discomfort and discomfort. Should it not be treated, it could lead to an abscess on the tooth or tooth loss. When performing a root canal, the dentist removes the affected or damaged pulp of the tooth. The dentist will remove and clean the inside of the tooth. The tooth is then sealed with an implant or crown to avoid further infection. This procedure can keep the tooth healthy and reduce the need to extract it. How long does a root canal procedure take? The time frame for an operation to treat a root canal may vary according to a number of variables, including the position and size of the tooth to be taken care of, the extent of damage or infection, and the patient's personal anatomy and the degree of pain tolerance. A typical root canal procedure may last between 1 and 2 hours to finish. But, in certain instances procedures, it can require longer time in the case of teeth that are particularly intricate, or there are problems such as curving or narrow canals for root, multiple canals, or presence of any additional diseases or abscesses. The initial step of an operation called a root canal to reduce the pain of the tooth by using local anesthetic to guarantee that the patient remains relaxed and comfortable during procedure. When the region is completely covered in numbness, the dentist can make use of special tools to get access to the inner part of the tooth and then eliminate the damaged or infected pulp. When the pulp is removed, the dentist then cleans and disinfects the inner part of the tooth, removing all debris and bacteria. This procedure is vital in preventing the spread disease and for ensuring the effectiveness of root canal therapy. When the tooth is completely cleaned, after which the dentist seals the tooth by crown or filling in order to safeguard it from infection, as well as restore its function and strength. The final stage of the procedure of a root canal is to obtain an X-ray of the tooth to verify that the treatment was effective and there aren't any signs of infection or other complications. Recovery after a root canal procedure. In the aftermath of a root canal can cause you to experience a little discomfort or tenderness in the tooth. There may also be minor swelling or bruising on the site. The majority of the time, this is temporary and can be treated using pain medications available over the counter or when you follow your dentist's instructions following the procedure. It is crucial to refrain from drinking hot or cold meals and drinks immediately following an operation to heal the root canal, because the tooth might be sensitive and more susceptible to irritation. It is also advised not to chew on the affected tooth until the tooth is completely fixed with a permanent crown or crown. The majority of patients can return to their usual lifestyle and dietary routines shortly after an operation to repair their root canal. However, it's important to check in with the dentist to schedule any required checkups to ensure the tooth's healing is going well and to ensure that there are no symptoms of infection or other complications. The root canal procedure is regular and successful dental treatment that could protect teeth that are damaged or infected and ease discomfort and pain. When they understand the process of undergoing a root canal, as well as what it can take to complete, the patient will feel well informed and ready for this vital dental procedure. If you're suffering from dental pain or discomfort, you must visit your dentist as soon as possible to determine the root canal procedure is needed and get proper treatment that will restore your dental health.